As was mentioned, I'm a health information science graduate from UVic. I did both the undergrad and the master's program. So really value these sessions that you guys have and the learning taking place. I draw on that experience all the time. And so just an amazing industry to be part of, and so much opportunity out there across our whole sector on where this field can really contribute to our advancing our healthcare system. So I'll get started, and then I'll pass it over to May. I want to acknowledge that that I'm presenting this on the unceded territories of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations. Thank you for having us here today. I'll start by providing you with a bit of an overview on our BC digital health strategy. This is actually the first time we're publicly sharing this material. It's just been refreshed. Our digital health strategy, or a new strategy, has been put in place after quite some broad consultation across our sector. It's recently been shared with the deputy and the minister, and just went to our CEOs of our health authorities last week. So really, you guys are starting to see this for the first time. We're actually sharing it with our staff next week. So keep in mind what we're sharing is draft. It's evolving, but it's landing well, and we're going through the validation process. So we're continuing to tweak it. And then May will give some updates on our public health response over the last 2 years, and share some of the highlights really on how digital health has helped advance us in our province, and kind of help give us a new light on really the value and the contributions it can make. So as a little bit of context, here's a bit of an overview of our region here in BC and how digital and virtual is organized. We've got a bit of a new team that's come together over the last little while to help strategize, solution, deliver, operate digital and virtual health for our province. We have quite a decentralized structure where typically IMIT digital virtual has been quite decentralized across the regional health authorities. But what happened during COVID is that we found that we couldn't work that way. We had to come together and work in a collaborative way. And so through our teams at Provincial Health Services Authority and the Ministry of Health, we came together and we created one team around our COVID response and how digital and virtual health could help. And so what we recognized is that we achieved some great things through that. And provincially, we recognize this is a good way of working that we want to continue in. And so with that, coming out of the pandemic, we formalized a provincial digital and virtual health organizational team and structure, where we're looking provincially at how we collaborate and achieve greater kind of efficiencies and some consolidation across digital and virtual health. And so with that, I kind of wear a dual hat, reporting into both PHSA and the ministry, serving our health authorities, and also working with our partners in the broader sector, Doctors of BC and our primary care partners, to really take a bit of a different approach on how we look at and solution digital and virtual health across our province. So it's new, it's evolving, but really exciting, and really exciting to see kind of the provincial level focus on how digital and virtual health can really enable our health system. I've been talking a lot with our deputy on how we advance some of our overall health system strategy. And it's interesting to know in previous years, we've always had a health strategy where the bottom line is all around, you've got your whole health strategy, and at the very bottom you have one line on, and IMIT will enable this. Well, now we're shifting the strategy to talk about all these challenges that we have around health human resources, and we don't have more resources to put at our problems. And so it's interesting looking at our strategy material now. We're talking about how digital health can really help enable transformation. And here are the things that we need to do in our health system. And so it's been amazing to kind of see that shift in the recognition that that digital and virtual is getting across our overall health system. So what are we talking about when we talk about digital health? I'm not going to read this slide in detail, but just to say, when we talk about a digital health strategy and digital health here in the province of BC, we're talking about everything, all encompassing of solutions that citizens, patients will leverage. Virtual health is a component within digital health in our minds here, to all of the clinical information systems in the hospitals and the doctors' offices, and to the back office technology and infrastructure that we need. So we're really using this as a very broad term to encompass all digital, virtual, and IMIT in our province, and really looking at how we leverage information technology, tools, services, processes to support citizens, to support consumers, patients, and then to support providers in the broadest sense. All of our clinicians, our nurses, our allied health professionals. So we use that term in the broadest sense here. Some of what digital health may mean from an individual or a provider or a health system perspective, we've tried to capture here to help resonate what digital health means to our users, to us in the system. From a citizen perspective, that may mean having our own health information available to us at any point in time that we know we can trust. From a healthcare provider perspective, it may mean having that same health information on their patients available to them so that they can make the best decisions possible. And then being able to collaborate and communicate with other providers. Another thing that we've heard from the providers is really helping them have more flexibility in their schedules to ensure that they're being as efficient as they can with their time, to spend it on focused on providing care and treating patients, and really reducing the overhead of the administration that they feel today. And from a health system perspective, having this information, the data available in a real-time basis to understand how we're doing. And we, our politicians had a glimpse of that in COVID when we were able to provide stats like immediately on our vaccination progress, and want it more across the health system. So it's a little bit of the different perspectives. I threw this slide in here because I like it in terms of communicating where we've evolved to with digital health. Traditional models, this is a slide from Gartner. Traditional models of IMIT have tended to focus in the middle around the core treatment area and really looking at how we move paper to electronic in hospitals with clinical information systems. And for years, we've been investing billions of dollars in clinical information systems in hospital facilities. We still are. But we've recognized that that's not really the value, and it is great value, but we can have so much more impact and value on keeping patients in their home and healthy in their home by leveraging digital and virtual health across the continuum of care, and really looking at how we support citizens, patients with information tools and processes where and when they need them, not just in the hospital. And so I think that's where we've really evolved to from a digital health perspective. Here's a couple of the highlights over the last 2 years. May is going to go into some of these examples specifically, so I won't go through this in too much detail. But other than to share, we've really been working on how we advance citizen access to health information and citizen access to tools. We've got more work to do there, but really trying to look at increasing patient empowerment. We've been supporting healthcare providers with being able to work remotely over the last 2 years. Once COVID happened, we immediately had to put out solutions like virtual care solutions, Zoom, solutions for them to talk with their patients, solutions for them to access their files when they weren't in the office, solutions for them to talk with other providers. And what we've found, you'll see in the strategy, is that we put out a number of solutions, but they were actually a bit disconnected. And it's actually increased the burden that they're feeling with all of these different tools that they're having to use. And so how can we help improve that experience now? And then I'd say overall really strengthened the alliance across our province, and built a lot of collaborative forums that we're now looking at how we scale for other areas in digital health, back to the opening around our new organizational structure. So I'll let May go into more of that. So we've been refreshing our digital health strategy coming out of the pandemic, recognizing we need to focus on a strategy that was created in 2019, prior to the pandemic, that we never really got to. And so this spring, we started quite broad stakeholder engagement across all our health authorities, across primary care providers. We had citizen research that was conducted, and all of that has now converged to create a new digital health strategy document, which I'm going to start to share with you here, where we're in the process of just validating and really building the roadmap around now, and continuing to tweak it. So it's meant to be something that can live on, where we refresh on an annual basis, and so I'll start to share some of the strategic objectives. Lots of great broad stakeholder engagement, as I mentioned, was conducted into this. So we tried to make sure all voices were heard. And what we heard was we needed to do things differently. We needed to make the digital health strategy that was done a couple of years ago look and feel quite different from what it was. And so this is quite a new strategy from what was originally created. Here's some of the themes that came up. These are themes that came up in every interview that we had, touched on these. And by the time you got to 25, we were hearing these in repetition. And so it's a good indicator that these form, strategic objectives and strategic priorities, which I think you'll see in the coming slides. Lots of comments around how we can support our health human resource challenges that we have right now, and just the capacity constraints that our system is feeling. Comments around how we can help improve equity and inclusion when we're thinking about digital health solutions, and recognizing that Canadian government-made solutions aren't going to fit all populations, and how do we look at more marginalized populations and really recognize the unique needs of First Nations. Promote information sharing. How can we ensure information is exchanged across the continuum of care, not looking at this on kind of a piecemeal basis, but looking at this holistically. Continuing to provide a patient-centric approach and leading from a clinical and a patient-centric approach when we're implementing solutions. How we sustain virtual health. We implemented a whole ton of virtual health, which May's going to highlight, throughout the pandemic. How do we sustain this? We've taken virtual health to a new level. How can we consolidate some of that and make sure it's appropriately used and available? And then we design for the long term in mind, so that we don't add to, we've got considerable technical debt in this province, where we have a number of on-premise legacy applications. We cannot add to that. We need to be thinking modern technologies that take us further, that last us, that are sustainable, scalable, cloud-based, and can grow with us. So those are some of the themes. And I'll flip over to the digital health strategy that's created. So we're at the point where we've got principles, we've got strategic objectives, and we're now forming our strategic priorities to build our roadmap. So we have 5 principles. One is all around equity and inclusion. So creating a digital health system that reflects the cultural, demographic, geographic diversity of the province, really to ensure quality and safety of healthcare services is provided for all. We're still tweaking some of the language. We've added safety in here. We take a provincial mindset. So we employ a provincial outlook and approach to really implement and sustain these digital health solutions. We have a situation where, one health authority is implementing a solution that another health authority is decommissioning. We need to make sure that we're collaborating, we're exchanging, we're looking at this provincially to say, why is that happening? System optimization is a third principle. So leveraging digital health solutions that really improve the clinical workflow and alleviate their burden. Back to the point that we, implemented 5-8 different solutions to clinicians over COVID with different logins out of patient and provider context. How can we make sure when we implement that next solution, it's connected, it's integrated, it's part of their workflow, and that we don't implement solutions anymore that are standalone or piecemeal. Innovation, we adopt innovative tools and technologies throughout the continuum of care, really looking at some of the conversation you guys have had over the last 2 days. How do we leverage AI? An example here is chatbots or AI in solutions to help with triage functions, to really support with how we could actually alleviate the need for additional resources, and actually how can we leverage technology to supplement resourcing and support. And then future focus, taking that future focused perspective when we're making decisions around these tools, back to ensuring that these are sustainable solutions for the long term. So those are our principles. Here's a look at our strategy on a page. Our goal is a digitally enabled health system trusted by all who use it. The vision: digital health services, tools, and processes support a connected, trusted, and safe health system, which we've added in, empower all users, both patients and clinicians, and help address our BC health needs. We have 4 strategic objectives. I'm going to talk about those in detail on the next slide because that's really the meat of the presentation. And then we've got some critical enablers that we're still working through, but we know we need, regardless of these objectives, we just need to have these in place and work to have these in place. I'll flip into, just in the interest of time, the strategic objectives, but just a setup slide to say kind of all the input that went into finding these objectives, the quintuple aim being an input, the themes from the stakeholder engagement being an input, and a lot of research into what other jurisdictions are doing. We've had some fascinating conversations with the Australia Digital Health Agency, the UK, to really exchange stories on where others are focused.
And so it's so nice to see everyone here today, and thanks so much for coming together and allowing us to share with you some of the exciting work that's been going on over the last couple of years. So I am a registered nurse, and I work with Shannon and the Provincial Digital and Virtual Health team with MOH. And I would like to gratefully acknowledge that I work and live on the traditional and ancestral lands of the Musqueam, Squamish, and Tsleil-Waututh nations in this place currently known as Vancouver. So we've got 3 regions represented here today, and I really do give thanks as an uninvited guest on these lands. And today, on behalf of all of the teams who played a role over the last 2 years, I'm fortunate to share with you some of the stories about supporting the people of BC through COVID-19 with public health digital solutions. Next slide, please, Shannon. Thanks. So, if you remember, as we were all, locked in lockdown and watching with bated breath what was happening with the pandemic, every time Dr. Bonnie Henry and Minister Adrian Dix took the podium to guide people in BC through the pandemic, there was a dedicated team behind them of leaders, clinicians, service agents, writers, communicators, designers, technologists, and volunteers that stood behind them to help people follow public health orders and stay safe. So truly, you know, the story of BC's success in the face of this pandemic was a testament about the power of coming together and working as a team around people-centered goals through this global emergency. So through tight coordination between national, provincial, regional leadership, operations, communications, and digital and virtual health teams, we addressed a number of key challenges, such as reaching at-risk remote and Indigenous communities, managing the inventory and supply distribution around the province, to standing up and managing capacity of vaccine clinics, large and small, urban to remote. And as you can recall, you know, the summer we had last year, wildfires, heat dome, and floods, those clinics required, you know, the rescheduling of hundreds of thousands of citizens. And through a number of our digital solutions, we were able to carefully orchestrate the rescheduling of many of those in need. And so we did that across our regional health authorities, and then later worked with our pharmacy partners across almost 1,100 pharmacies. Next slide, please. So we knew here that the stakes were high. Provincial health orders stalled whole industries and asked people to stay away from work and from travel and from their loved ones. And so people needed information in the simplest terms, in a way that met their needs. So here's a little slide about the BC vaccine program. I'll talk about that in just a sec, but, you know, taking a step back, you know, before the vaccine actually was introduced to BC, you know, do you remember how you accessed information, how you, you know, understood what were the different kind of phases that that Dr. Bonnie Henry and Minister Dix took us through in order to keep us safe, keep us calm, and to keep going until we could see, you know, the light at the end of this. So I'll talk a little bit in more detail about this program here, but this slide is available for you for a little more information on the vaccine program itself. And on to the next slide, please, Shannon. Thank you. So in terms of reaching out to people, so I really love this slide because you see some of the faces that were involved in the campaign. You know, we used every medium possible for maximum reach: press conference live streaming, social media posts with over 300 million views, plain language summaries of the provincial health orders with over 220 million views, news media releases and events, contact centers with live agents on the other end to answer calls, and telephone and video town halls connecting people to their local leadership. And so creating this quality inclusive information and trying to reach the populations was complex, as you can imagine. Information was made available in 12 languages, as you can see there, you know, some examples there on the screen. And during live streams, American Sign Language was used. But then came the news of the COVID-19 vaccine. So as we move to the next slide, Shannon, thank you. I don't know when this will ever happen again, when my VP gets to move slides for me. So thank you. So news of the COVID-19 vaccine's arrival came in the absence of any system or any service capable of vaccinating 4.5 million people twice over with a booster in less than a 12-month period. It really was incredible, this feat we had in front of us. We knew we needed a system for larger volumes to engage and vaccinate up to 65,000 people a week at the height of the campaign. And the system had to be simple and flexible enough to support our most vulnerable people. So with a blend of public servants, such as myself and Shannon and the whole thousands of team members behind us, the private sector partners worked day and night to build the Get Vaccinated webpage and the ImmsBC digital platform so that people could go online, register for the vaccine anywhere in the province, day or night. A provincial call center was also stood up, and at the height of the campaign, agents handled 50,000 to 70,000 calls a week. So for those of you amongst the audience here in BC, at least, who received texts and emails about your vaccine, received information directly, to your preference, your contact preference, that was all ImmsBC. So health authorities and pharmacy providers use the platform that is briefly described here on the screen to manage your notifications, reminders, appointment scheduling, inventory, vaccine record documentation, and real-time data reporting and analytics by our tremendous provincial and regional analytics decision support teams. And this larger platform of a system took us pretty much 9 weeks from product goals on a virtual whiteboard to a minimum viable product in a live environment. And unbelievably, all of this implementation was done virtually. And I actually didn't get to meet many of my team members in person until just a few months ago. So really incredible how we were able to, get work done in ways that we thought we didn't know how to. We thought we didn't know how, but we actually proved ourselves. 24,000 users needed change management and training to support the implementation of the ImmsBC vaccine solution. And most of these providers received training on the same day as the clinic. So to me, that was very satisfying because that demonstrated high ease of use of the system. So next slide, please, Shannon. Thank you. So this is what the last 2 slides here before we get to other solutions is what I'm so proud about. By now, as a result of all our joint efforts and commitment, BC is emerging from the pandemic with the following outcomes. One of the best protected populations in the world with over 90% vaccination rate. And as of April 8, our provincial restrictions were lifted. As of February of this year, so I need a few months to update this, but the ImmsBC platform had supported registration of 4.5 million people, over 50 million SMS text notifications, 18 million notifications. So you can actually see here how people preferred SMS over email, but anyway, and almost 10 million booked appointments. And then for those, we still performed our research regularly throughout the campaign, especially focusing on equity to understand what people, what people needed, even towards the margins of society. And, we made sure that vaccine cards could be printed and mailed to those who didn't have digital tools. And so, with that, 97% citizen satisfaction, 87% provider satisfaction, and from my personal clinical perspective, a justifiable cost per capita because of the hundreds of thousands of lives that were saved from serious illness, hospital admissions, and possibly death. So with that, over to the next slide. Really, this is, if there's nothing else that you take away from today, here are our top 5 best practices. We all knew what we needed to do, right? The communications, I think, were fairly clear, and we were able to keep the economy going and get people vaccinated. And we couldn't have done that without understanding what was at stake through our communications planning, without the clear vision and person-centered goals, without the clear leadership and accountability. And Shannon had a huge hand in that and bringing everyone together. So we all worked together, the way that we wanted our solutions to work seamlessly together. Agile business processes, agile technical delivery, feel free to contact me and we can talk more about, Scrum and stuff. And then becoming a true learning system with real-time use of data. So I just have 5 more minutes to share with you, and I realize we're running against the clock here, but case and contact tracing systems. So next slide. Thanks, Shannon. So we all know already by now, we're all armchair experts in public health, right? So we know, with every contact traced before becoming a case, we broke chains of transmission. With population data collected through the case and contact tracing system, we collected information about clusters, outbreaks in our neighborhoods and cities. We were able to identify hotspots and then report these to Dr. Penny Ballum and the public health leadership. And then through the ImmsBC platform we just talked about, we sent targeted notifications to people living in those hotspots, informing them of their vaccine eligibility and encouraging them to get vaccinated. So we really did try using real-time use of our data to identify those, subsets of populations that were at higher risk, so that we could at least, try to balance out the safety and the equity and access to the vaccine. So can you imagine, as Shannon was mentioning earlier, Excel spreadsheets. Holy smoke, before this solution, CCT and for other communicable diseases as well was performed primarily on spreadsheets. But similar to ImmsBC, the case and contact tracing app was stood up in agile fashion, deployed in just a couple of weeks actually. Next slide, please. Thank you. So there's just some information here for you about what were the components of the solution. And then the next slide will show you a little bit about some of our really excellent outcomes as well here. And over 110 cases were managed through this app across Vancouver Coastal Health and Island Health alone. So that's pretty amazing. So the last, I only have 3 slides to go. Virtual health statistics for patient and provider experience. So this is the really neat thing where, if you've ever gone online to check your vaccine status and download your provincial and federal proofs of vaccination, you all probably know Health Gateway really well. Actually, Health Gateway was there before COVID-19. And as you can see, the adoption grew very quickly through the pandemic there. But citizens can benefit not only from access to their vaccine status, but also access to other information about their health, as you can see here on the screen. So please take some time and go and explore your own Health Gateway profile. Over to the next slide, we do talk about virtual supports for physicians. So PHSA published a COVID-19 virtual toolkit, and that was a set of tools made available to providers that either met privacy and security standards or was approved temporarily under ministerial order to connect patients to providers through chat apps and Zoom, which we'll look at a little later on. The virtual care pathways. So for those of you that have loved ones who are clinically extremely vulnerable, this COVID-19 antivirals pathway was really important, right? Like my own father, who is a CEV client, immunocompromised as a transplant patient, is part of a cohort with the highest mortality rate from COVID. And so, if he ever were to catch COVID, which he did during this pandemic, he needed the sotrovimab IV. And this is the antiviral that, confuses the virus to stop from replicating, but you need that medication to be administered to your citizen or to your patient within 5 days of the initial onset of symptoms. So you can see how important it is for your set of solutions to, seamlessly exchange information and to allow providers to be able to work as efficiently as possible, for providers and the pharmacists to complete their assessments, prescribe the medication, send the script to the provincial warehouse where this sotrovimab was available, then call the patient to the nearest outpatient clinic and then receive the treatment. And that was all really meant to save additional lives on top of what the vaccine could provide. And then for home health monitoring, if you remember back in the first couple of months of COVID, when there was no vaccine, we did not understand what symptoms we were looking out for. We did not understand the risk factors, who was dying from it. We were afraid for ourselves and for our loved ones, but home health monitoring was used to support people at home through their symptom management by having patients answering daily symptom questions, monitoring their heart rate, their respiratory rate, and helping them through their anxiety and to help them through their symptoms. And then finally, our last slide, and we really look forward to your questions. Zoom. So for patients and providers to virtualize their clinics and outpatient programs to stay connected despite the social distancing. And we're on Zoom right now, but 96%.
It's strange. I don't know. That just happened. If it's like something.
Apologies. Oh, great. Thanks, Pierce. 96% patient satisfaction, over 17,000 kilometers saved, helping the environment. There's more provider information on the final slide here. But all of this in the past 2 years, again, a testament to our courage, our grit, our innovative spirit, our collaboration, our ability to work throughout our lack of sleep. And despite disagreements and differences, you know, we put those aside so that we could continue to work around person-centered goals. So we know we can never go back again to the way we used to be. And so through these digital and virtual health solutions and innovations, I feel we have proven that we can positively impact health outcomes together. We look forward to applying our lessons learned and best practices to the challenges that lie ahead of us in health. So thank you so much.